Good afternoon. I want to welcome all of you here. With me today is Dr. William Santoro from Tower Health, Stan Papadimitriou, the Executive Director of the Council on Chemical Abuse, Chief County Detective Michael Gumbar, and Lieutenant Nelson Ortiz, the leader of my narcotics unit. By noon today, we had 101 overdoses in our community, our county, since Saturday of this past weekend. 71 of those overdoses went to Tower Health, Reading Hospital. 30 of those overdoses went to St. Joe's, part of Penn State Health, for a total of 101. Those numbers are shocking, astronomical, and I could utilize many other terms to describe them. Unprecedented for certain. Now, this number encompasses as best possible the number of people who sought treatment at Reading Hospital, Tower Health this weekend and Monday, and St. Joe's, Saturday, Sunday, and Monday. But we'll talk a little bit more about this issue. Dr. Santoro will address that issue about the number seeking treatment. But it has put a serious strain on the hospitals and on our, especially our emergency rooms. It has put a strain on healthcare here in our county. Now, of those numbers, could some people have been gone to Reading Hospital and have then reused and ended up at another hospital? Always possible. Could some people have OD'd from purchasing substances outside the city of Reading? Possible. But clearly, a bad batch of drugs landed in our community, and we are taking steps to stamp out this problem. How it began on Saturday. We received information approximately 1 p.m. That there were a large number of overdoses being seen at Tower Health. I immediately contacted Lieutenant Ortiz, the head of my narcotics unit. We went to Tower Health. We collected some evidence, which was immediately taken to the Pennsylvania State Police lab. Reading Vice was contacted, and the Reading Vice unit and my detectives took immediate steps to combat what we believed was the source of this drugs. A search warrant was executed initially on Sunday at 3 o'clock in the 200 block of North 8th Street, and confiscated, among many other things, was 250 blue bags containing heroin, fentanyl, and other drugs, which I will speak to as further in my comments. 2 people were arrested, Jason Cordaro and Dimitri Ortega. They are in custody at Berks County Jail. Second search warrant was executed yesterday by the Reading Vice unit and detectives from my unit. During that raid, no blue bags were found. And the blue bags seem to be the bags which contain the substances that are causing all of the overdoses in our community. Search warrant number 3 was executed this morning. That search warrant was executed again by members of the Reading Vice unit and by detectives from the Berks County District Attorney's Office. That was executed at 130 Walnut Street in Berks County. 3 people were arrested: Sixto Cruz, Jose Hernandez Hieles, and George Cruz. They have all been charged with possession with intent to deliver of heroin and fentanyl and cocaine. That raid was conducted after a search warrant was obtained. As a result of that execution of that search warrant, approximately 250 bags, each containing heroin, fentanyl, and other substances, which we will get into later on, were confiscated from that location. About 100 packets of crack cocaine, one fully loaded sawed-off shotgun, miscellaneous packaging materials, two-way handheld portable radios, and a substantial amount of U.S. currency, over $16,000. The blue glassine packets, which were confiscated at this address at 130 Walnut Street, were identical to the previous packets seized from overdose cases, which were found not only as a result of people going to the emergency room with overdose symptoms, but they were also consistent with the bags that were seized in the 200 block of North 8th Street on Sunday at 3 o'clock when that search warrant was executed. So we're doing everything possible to continue to enforce our drug laws and to stamp out these illicit drugs that are poisoning our community. The blue bags that have been found, and Dr. Santoro will talk more about this, but at this point, we believe that they contain heroin, fentanyl, lidocaine, xylazine, and clonidine. Many of these compounds they identified in the sample are typical to what we find in other substances that are seized. We will have more information on that from Dr. Santoro. But the drug overdoses that have occurred here are often linked to a mixture of many different drugs. Typically, we find heroin, fentanyl, methamphetamine, and cocaine in the substances that we seize and test. The use of xylazine in the United States has increased since 2015. Xylazine is described as a horse tranquilizer, and it is used by veterinarians. It's not a human drug, and at this point, it may not. We believe it's a non-controlled substance. So we need to get the message out, and we need to get the message out loud and clear. Number one, we're going to do everything we can to stamp out the dealers of this poison in our community. If you're a user, do not use a substance in a blue bag and seek treatment. In closing, I do want to thank the Reading Vice Unit and detectives from my office. They took immediate steps to stop the flow of the lethal and dangerous combination of drugs that are being sold in our community. They have worked tirelessly since Saturday evening when this came to light. We have stopped some sources of these drugs, but we do believe that there may be other sources and they still may be active. If you have any other information on the source of this heroin, fentanyl cocktail, this poison, please contact the Reading Police, the District Attorney's Detective Unit, or Crime Alert Berks County. At this point, we are very fortunate that we believe out of the 101 overdoses treated at area hospitals, only one has resulted in the loss of life. But that is one too many. At this point, I think it is kind of unprecedented that this amount of overdoses is just unbelievable. And I think I'd like to turn it over to Dr. Santoro for some comments in regard to the what they are seeing medically and also what we are seeing at our area healthcare hospitals in Berks County. So, Dr. Santoro.
Thank you, Mr. Adams. First, what people think they are buying is not what they're getting. They believe they're buying heroin or fentanyl, but they're not. I don't know what they're getting, but the symptoms that they're experiencing are not from heroin or fentanyl. I look at this more, as Mr. Adams had said, as a poisoning, rather than as an overdose. Narcan can reverse the effects of opioids or opiates that are present, but Narcan does not reverse the effects of whatever this toxin is. This toxin, whatever it is affecting the heart. The care team in the hospital includes hospitalists, toxicologists, cardiologists, as well as addiction medicine physicians. Multiple specimens have been prepared and sent to a specialty lab outside of the local community that does specifically higher level testings. And although everyone, including the lab, is working as quickly as possible, it's still going to take time before this information comes back. I am absolutely certain that we'll be able to figure out what this is. Until then, of course, I would not recommend anybody using any illicit substance, but I would especially recommend that they not use this particular substance. People have been asking me, how do the patients present? They're using one bag and getting tired, falling asleep for lengthy periods of time. Some of the patients weren't able to tell us how long they went to sleep for. When they wake up, they're disoriented. They have a difficult time walking. They're very weak, have a slow heart rate, and we've seen in the hospital that the blood pressure goes up. This does not match to the symptoms that we would expect from xylazine, so I'm thinking there's something other than xylazine in there, and the specialty lab will hopefully figure that out for us shortly. Some patients have even complained of hallucinations, and many of them are complaining of shortness of breath. As was mentioned earlier, there's at least 70 people that came into Reading Hospital and approximately 30 people who went to St. Joseph's Hospital. The symptoms are lasting days, not hours or minutes. Again, something different than what we've seen before. Many of the people who were admitted to the hospital on Saturday are still experiencing symptoms today, so 4 days later. Approximately 2/3 of the people who show up at the hospital are sick enough to warrant getting hospitalized. And I want to stress that they are getting the care they need. I know that with the pandemic and everything else, people talking about overcrowding and the stress on the community, I can say that my colleagues and the hospital have stepped up. There is room. We will take care of people. We are taking care of people. They are getting the absolute appropriate care that is necessary. And with that, if there are any questions.
Yeah, could you just speak to Dr. I had heard that Reading Hospital had ran out of Narcan over the weekend. I know it's not necessarily helping in these situations with these different toxins, but the availability of that right now in terms of at the hospital.
I had not heard that. I'll have to look into it. I have not heard that. With this number coming through, I'm sure the supply has been pushed, but I would be shocked that a place like Tower Health would not be able to reach out to their sister hospitals and make sure that they have enough to cover the community. But it is something I will look into.
Would you say that the most dangerous of these other toxins is the xylazine, the horse tranquilizer at this point, or the one that you can't identify yet?
I would say the one we can't identify. Xylazine has been out there for several years. We can only test here what we're testing for. Specialty labs test for anything under the sun that we don't even know what to begin to test for. That's why we have the specialty labs, and that's where the specimens are going to. And they were shipped out immediately by courier, so they're there. It's just a matter of getting the work done.
I know we hear a lot about the warm handoff program. Do you have any numbers in terms of how many may have gone into treatment following this out of the...
I can say that with the numbers of consults that were done, we're anticipating more people, of those people, going into treatment, which is a good thing, but I don't have exact numbers for you.
Okay. Step up back here. At this point, I would like to call on Stan Papadimitriou, the head of the Council on Chemical Abuse.
Thank you, District Attorney Adams, and for inviting me here today, and thank you, Dr. Santoro, for giving us an explanation of what's going on in the community. The overdose crisis in Berks County rages on, but what we've seen over this past weekend and what we're learning about this past weekend is something that no one could have imagined and no one would have expected. The simple message I have is that Narcan is available. We do have Narcan available for the community. And we urge folks to arm themselves with Narcan. Now, while Narcan may not have reversed what happened over this weekend, we know that the overdose deaths numbers in Berks County are skyrocketing this year, and Narcan is something that should be out there. If anyone suspects a loved one that might have a substance use issue involving opioids, Narcan is a good thing to arm yourself with and have. And the other thing I want to make clear here, and I'm glad I'm here to do, is to say that treatment and other resources to combat substance use disorders are readily available in Berks County. I urge folks who may think they have a substance use issue, addiction issue, or a loved one that has a substance use issue or addiction issue, to not think because of COVID that treatment has stopped. Treatment continues. Drug and alcohol treatment continues. We urge people to seek such treatment. As opposed to inundating you all with a bunch of numbers and websites and all those things, let me just kind of direct you to www.cocaberks.org. There's a lot of resources there. How to get Narcan, it's very simple. No questions asked. We don't care why you want it, but if you're a resident of the county, we will make it available to you. And the same with treatment. What treatment options are available to you? So I appreciate the opportunity just to get up and say treatment is available. Treatment does work. And we're actually smack dab middle of Recovery Month, which is the month of September. And we know that many people who have substance use disorders do recover from their disorder, from their addiction. And it's estimated over 30,000 individuals in Berks County are in recovery from a substance use disorder. So just because someone has a quote-unquote drug problem, and we're frustrated with them sometimes in terms of them not getting the appropriate help, there is help available, and people do get better. So that's the message I wanted to pass on today. I appreciate the district attorney inviting me to this press conference.
Thank you. Thank you for coming. Hopefully our message will be shared with all the members of our community, and I will take any questions that you may have at this point.
Yeah, John, just the arrests here were made fairly quickly, it seemed like, after. If you could speak to just sort of backtracking, was it victims of the overdoses telling where they got the drugs to backtrack to get these two people arrested?
Well, we received some information as a result of that, and we were also, based on our intelligence, were able to determine where we thought these drugs were coming from. So it was really the hard, dedicated work of the Reading Vice Unit and detectives from the Berks County District Attorney's Office, my detectives. They did a great job by getting ahead of this as soon as possible. And none of us, I don't think, ever could have predicted anything of this nature occurring. But we hopefully have stopped the source, but we do believe that there may be other sources out there. That's why we need the public's help, and that is why our enforcement will continue, because we have to stop this poison from being spread any further in our city and our county.
Any idea how they might be obtaining the horse tranquilizer or these other toxins? Is it cheaper in terms of making it, distributing it?
I think you have to know that there's no quality assurance when you're buying drugs on the street. And the example that unfortunately has occurred here in this county just exemplifies that point. There's no quality, and you do not know what you're getting. You could just get straight poison. So that's why I am warning everyone, do not use anything that's in a blue bag, and frankly, seek treatment. Do not use drugs, because at this point, based upon what we are seeing, you are taking your, you could suffer the ultimate consequence.
Are you still seeing more of the blue packets?
Well, we have seen the blue packets. We
Yeah.
believe the blue packets are the source of all of the issues that we have had. And we seized more blue packets this morning.
Okay.
Are there other blue packets out there? I'm sure there are, and that's why we want to get the message out. Do not use substances that are well, do not use drugs, but do not use the drugs that are in a blue packet, because we don't know. What's, I think, clear what Dr. Santoro said. We don't know what's in there, but something's in there that's causing serious health issues. Anything else? Okay. Thank you very much.